Hi, this message is for anybody involved in the American dental industry. My name is Adam Niemer. I'm a former CFO and senior operations executive of a multi-billion-dollar healthcare system on the West Coast who struggled unknowingly throughout his entire executive career with severe depression and anxiety. I had an 18-year anxiety attack layered on top of severe depression while I was a CFO of a $3 billion healthcare system, and I had no clue. I just thought that how I felt, always being so sad and so scared and not being able to control my emotions, and frankly, being a real son of a bitch to everyone around me sometimes, was just what life was supposed to feel like. But then a mental health literate colleague recognized the signs in me that I might be struggling, and in a 5-minute conversation encouraged me to get some help. It set me out on a journey of recovery, and it's made the moments since then so much more full of love and joy and happiness, and it made me a much more effective and productive leader. 7 years later, I work with leaders across America, inspiring and educating them to become mental health literate, teaching them how to help their colleagues in 5-minute conversations, just like mine helped me. And connecting the dots for them between these 5-minute conversations and propelling their business performance. And over the last few years, I've had the privilege to work and talk with dental leaders and associations from across America. From Maine, New York, Kentucky, and Connecticut to Oregon, Indiana, New Hampshire, and Massachusetts. And I've gotten to chat with a lot of folk at the ADA in Chicago. And I've come to understand the unique challenges that y'all are in. It appears that dentistry across America is struggling with the same core set of issues. I haven't met a dental leader from any part of America yet that hasn't voiced similar challenges. Challenges made all the more profound by the pandemic. Look, I know I'm preaching to the choir here. Reimbursement rates are down. Supply costs are 4 times the level since before the pandemic. Severe staffing shortages across the country, hygienists, dental assistants. Across the country, dental practices are struggling with the exact same issues. And I wrote and filmed this message for y'all because I think that there's something that you can do about it. Something that's really simple. And when you do, it's going to help your practices thrive, help your colleagues live more satisfying lives, and help your patients far beyond their oral health. It's going to turn around your industry, and even bigger than that, y'all have the opportunity to play a key role in resolving one of our society's greatest dilemmas. Look, we're in a crisis in America, a crisis that's being felt especially deeply in the dental industry, impacting your lives, the lives of your staff, and the health of your practices. But it's also a crisis that the American dental community is in a unique position to take the lead in solving. This crisis, it's a mental health crisis, and the evidence-based statistics are straightforward. More than 20% of Americans every year experience what a behavioral health clinician would diagnose as a mental illness. Yet, in spite of the fact that conventional therapies work and that recovery from mental illness is possible, probable, and expected, in spite of that, less than half of us seek out help. And for those that do, it takes on average almost 11 years between the onset of symptoms and first getting help. And 80% of the people who don't get help report that it's stigma alone that prevents them from seeking care, right? So do the math. That means that 10% of the American population every year is experiencing a clinically diagnosable mental illness. Illnesses that hurt like hell, that hurt just as much as any physical illness. But 10% of us, we're not getting help just because of what other people might think. It's insidious, this stigma. Do you imagine if 10% of us got cancer every year but didn't get help just because of what we thought other people might think? And those stats, 20% of the population every year, right? That's pre-pandemic stats. It's a lot worse today, and it's far worse in your dental community. Here's some facts straight from the 2021 ADA Dentist Wellbeing Survey. Anxiety and depression are 2 of the top 4 medical conditions reported by dentists across the country. And the percentage of dentists diagnosed with anxiety has more than tripled from 2003 to 2021. And y'all currently report depression rates nearly 3.5 times that of the general population. And being from 2021, this data, those are basically pre-pandemic stats. It's a lot worse now. And after talking with your colleagues across the country and learning the unique demands of your profession, none of this seems surprising to me. Years of clinical education, training, and practice, yet y'all end up needing the same skills as a CEO, right? The regular juggling of the pressure for clinical precision with the day-to-day challenges of running a small business. And on top of that, your practices are challenged today with the same post-pandemic management headwinds as all of corporate America. Hiring, retaining, and engaging the workforce of tomorrow. And in the dental community, the national workforce shortage has made finding dental hygienists and assistants a recurring struggle. So much so that recent studies have shown that almost only 65% of dentists across America feel adequately staffed with hygienists and dental assistants. It's no wonder that y'all report depression at 3.5 times the rate of general population. And it's no wonder that dental practices across the country report economic struggles. Here's some more stats. Folks who struggle with depression have been shown to be 27% less productive. And they miss a lot of work. The Gallup Group recently published findings that found that Americans struggling with their mental well-being miss 4 times more work days. Right? And the Great Resignation, the workforce shortage in the dental industry. Check this out. Mindshare Partners has found that nearly 50% of millennials and 75% of Gen Zers have left a job in part due to mental health reasons. And just this past year, the American Psychological Association published a study that found that 81% of Americans report that how a future employer supports their mental well-being will be a significant factor for them in choosing their next job. It's no wonder that it's so hard to find hygienists and dental assistants today. And it's even harder to find dentists to join independent practices. Who would want this life? It's no wonder that dental students across America are choosing to join large group practices. Like everyone else in the workforce of tomorrow, they're choosing their mental well-being over their pocketbooks. You gotta wonder, how could we possibly have gotten to this place? Not just in the dental community, but as a country as a whole. How did we get to a place where 10% of our population every year doesn't get help just because of stigma, right? Well, it's the cycle. It's this insidious isolation cycle. It's a cycle that starts with the myths of mental illness that we've taught ourselves over the years, like depression isn't real. Well, these myths create the stigmas, right? Like folk with depression are just weak. They aren't resilient enough. They just gotta buck up. And the stigma fuels these feelings of shame, like, I feel depressed, I must be a weak person. What's wrong? So we stay silent, and it repeats itself, this cycle over and over and over again, and it just gets worse. But embedded in the problem is also the simple solution. Right? We just got to educate ourselves. It's not that hard to do. It's just learning the signs that a colleague might be struggling with their mental well-being and learning the words to use to engage them thoughtfully and non-judgmentally and guiding them to services so that they get help. There are actually 3 to 6 hour mental health literacy and mental health first aid classes available all across America today, ready to train you. Mental health literacy and mental health first aid, it's just like physical first aid literacy. It's an actual class, just like CPR is an actual class. When she was First Lady, Michelle Obama was trained in mental health first aid. In fact, she just spoke a few months ago at their national convention in St. Louis. Look, I know I'm preaching to the choir here, but dentists aren't just healthcare professionals. You're leaders and business owners. Leaders accountable for creating environments where staff can show up as their full selves every day and be the best teammates they can be and perform at the top of their game. And try as you might, you can't separate people from their emotions and feelings. And currently more than 20% of you and your teammates are struggling with fear, panic, and sadness. Regularly finding yourselves in fight or flight mode, missing work days, performing just barely enough to get by. Right? So choose to become mental health literate. Take a half-day class. And here's the real cool thing. Here's where the American dental community can take a lead in solving the mental health crisis in America. Recognizing the signs that someone might be struggling with their mental well-being is very often about noticing changes in their behavior over time. Someone who talks a lot may now be quiet. Someone who's normally calm may show up as frenetic. Right? We're looking for changes in behavior. And one of the most critical success factors when encouraging somebody to get help is starting the conversation from a relationship of trust and caring and respect. So American dentist, here's my question for you. What other medical specialty in America, let alone what other profession in America, sees nearly 50% of the population almost twice a year and has them captive in a chair for 30 to 60 minutes each time? Who else, what other profession develops multi-year, cross-generational relationships with their patients and their families? Right? What other profession in America is more well-suited to recognize the signs that people around them may be struggling with their mental well-being than their family dentist? Right? Think about the relationships of trust that are built between you and your patients. You see your patients for 5, 10, 15, 20, 25 plus years. You see their families, their parents, siblings, spouses. You see their friends, cousins, neighbors. And it's not just you, but the hygienists and dental assistants in your offices. They spend more time with and develop just as strong, if not stronger, relationships of trust with your patients as you do. Y'all can really change the world here. Look, I understand that there's this movement across American dentistry today, a movement referred to as medical dental integration, a movement founded on the principle that oral health is a key component of overall physical health and mental well-being, a movement that recognizes that dentists are in a unique position to improve the overall health of the American population, not just fix their teeth.
There aren't a lot of folk that we come across in our day-to-day lives who are better suited than a family dentist to recognize the signs that someone may be struggling with their mental well-being. And there aren't a lot of professions that have developed such unique relationships of trust with the American population to your community. So when you all notice that someone might be struggling with their mental well-being and you encourage them to get help, you know what's going to happen? They actually will. And then they're going to get better. I can't think of a greater gift than the American dental community can give America becoming mental literate. It's so easy to do. It just takes a half-day class to get started. You just take the class, start using what you learn with your colleagues in your practice the next day, and share the learnings with your practice staff. Even better, take the training with them. Your well-being will improve, their well-being will improve, your practice performance will improve. For the love of the universe, you guys can take the lead in solving the mental health crisis in America. Please, 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 please don't forget. What other profession develops such long-standing, trusting relationships of love that you all do with your patients? What other profession is in such an ideal position to successfully encourage a potentially struggling person to get help? You got to think of one. All you have to do is take a half-day class and use what it teaches you. It really is that simple. Be well. Can't wait to see what the ultimate is. I do.